Good morning. Thank you for joining us. GTV Breakfast News. I am Malti Tisaida Sadek. Around the world, we're on DSTV channel 278. Stories making headlines this morning. President Akufo-Addo has relieved the Ghana Revenue Authority commissioner of his post. Also, the Accra Zoo has beefed up security following Sunday's unfortunate incident. When we take you to the international front, a Ghanaian judge has been sworn in as judge of the African Court of Human and People's Rights. Let's start off with matters around the Ghana Revenue Authority, where the Commissioner of the Customs Division of the GRA, Colonel Retired Kwejo Damwa, has been relieved of his duties as boss of customs. He has been asked to hand over his duties in office to the Acting Deputy Commissioner, Seidu Idrisu Idisa. Mr. Idrisu Idisa is to act as the Commissioner of Customs Division pending the President's substantive appointment. The directive took effect on Friday, August 26, 2022, and the order was contained in a letter from the Presidency signed by the President's Executive Secretary, Nana Bediatou Asante. Let's look at matters around the Accra Zoo, where security is to be beefed up at the Accra Zoo henceforth, including the possible installation of CCTV cameras at the recreational center as part of measures to improve on security. Forest officials have shut down criticism of security lapses at the facility, leading to Sunday's unusual incident where lions allegedly killed a man.
There are several accounts on the minds of the public following Sunday's rare incidents, with some suspecting foul play, with thoughts that the man might have been allegedly killed and thrown into the den of the lions. According to the Forestry Commission, that cannot be ascertained as there are laid down processes for admitting people into the forest and the zoo, and anyone who goes contrary to that is considered an intruder.
Now, the cages of the lions are a bit removed, far away from where the rest of the animals are. This is because we want to give the lions something close to their natural habitat, which is in the jungle. That's where they live. So they have a very big area where they walk around and then do whatever they want to do. Now, the place has been properly secured. There is a wall, a fence wall, and then it's under lock and key. Now, when you enter, there is an outer wall and there is an inner wall. The inner wall is 20 feet high. All visitors who go there are given a guide. You are given a brief on what to do, what not to do, the do's and don'ts. And then there's a guide to accompany you on all your rounds.
Officials say the facility is currently undergoing renovation, which will include new security measures to enhance surveillance.
Now, the zoo is under renovation. We are giving it a facelift, and all these things will come into play when the renovations are done. But for now, there are no CCTV cameras. After the renovation, all these things will be put in place. But we so much rely on our security patrols because they don't work, they don't sleep. Ashwater Forest is big. Apart from the Accra Zoo, there are other issues. So we are there 24/7 patrolling. But because we can't be at one place all the time 24/7, that was why this incident happened behind. We need more, not only security guards, we need more staff to do the work. Not only at Achimota Forest, but in all our national parks and protected areas.
As investigations are ongoing to Sunday's incident, the facility is temporarily closed to tourists and the general public, causing some revenue loss to the Forestry Commission. There are reports that onions, garlic, and a talisman were items found on the deceased, and some are suspecting he could have been there for rituals.
A cross-section of the public GBC News spoke to our relief that no lion has escaped from the Accra Zoo. The motive of the intruder is, however, yet to be determined.
Sense. He can't jump inside where he knows there's a lion. I was discussing with my family yesterday, and I told my wife the man maybe is a madman.
Because before
you must be strong enough to catch a puppy. How much more a cub? The incident is unfortunate.
okwa ebebo nti no Jesus a situation or no kokula mu no ono na epe ne ha no anya nti oha obi anim ye nyame afra no awon ko sa
o me ti ya jataba de okochi no de ne kwa de because
what exactly was he going to do with the cap? Because a mentally sound human being would not even go near the offense.
The story, as we've all heard it, I don't know whether there was someone there who can actually confirm that this said man actually went in there to steal. But then we'll wait for the police. As they said, they are probing the alleged incident. So with that one, I don't have much to say about it. We'll wait for the police to come out with their investigations so that we can conclude as to whether the man really actually went there to steal or not.
I think some more investigation be brave and found because
thorough investigations must be done as to what triggered the death of the man.
Then so we soon better no I think some
From the thoughts of the streets, the Ghana Journalists Association is encouraging journalists to patronize the 26th GJ Media Awards 2022 following a review of the scheme to attract members. It is calling for the submission of applications after the launch on Wednesday, 31st August 2022. A 7-member GJ Media Awards committee chaired by Dr. Sarah Krofi Koku, a lecturer at the Department of Communication Studies of the University of Ghana, will also be inaugurated on Wednesday to select the winners in due course. Now, this year's event is likely to take place in November. The National Communication Authority, NTA, has rolled out the SIM card registration self-service application on Google Play Store. The app, called GH SIM Self-Reg, provides another means for telecom subscribers to complete their SIM card re-registration using the Ghana card at a fee of 5 Ghana cedis. And let's go to the area around the Vice Presidency, where at the 2022 Medical and Dental Council Conference in Accra, the Vice President, Dr. Mahmoud Bawumia, tasked the Council to propose ways to close Ghana's doctor and dentist-to-patient ratio gap.
The Medical and Dental Council is the statutory body mandated to regulate the training and practice of medicine and dentistry in Ghana. The council is 50 years old this year, and the Medical Training and Practice Conference is part of activities to mark the anniversary. Christened Medical Training and Practice in Ghana, the past, present and future, the conference will, among others, seek to boost local production of general duty and specialist doctors and dentists, research in health professionals education and practice, as well as medical and dental education within and without the university framework. The president of the Ghana Medical Association, Dr. Frank Srebo, outlined some critical issues affecting medical doctors deserving attention.
Indeed, with the matter of the foreign trained doctors, His Excellency, a lot of them come in, they write the exam, they fail, they write again, they fail, and they write again and they fail. Do we just throw them into the abyss of frustration and depression? Or we seek a stakeholder consultation where we can find something that they can do? I have had several calls from some of them, and I can tell you that a lot of them are depressed. 6 years of education, they come home 3 times, 4 times, they are not passing, and we deem them to be useless. I don't think they are.
The chair of the Medical and Dental Council, Professor Paul Nyami, said the doctor-patient ratio of 1 to 3,000 must be improved.
The council is acutely aware that many qualified young people are unable to gain admission into medical schools in Ghana, excluded mainly by limited places, forcing some of them to go abroad. This is unfortunate, but it's not peculiar to Ghana. Besides this group, there are also the most unqualified students with inappropriate academic backgrounds who make their way into medical and dental schools abroad. some of these foreign schools are not fit for purpose.
The Minister for Health, Dr. Kwekwajiman Menu, urged the council to keep working on medical regulations in Ghana. The Vice President, Dr. Mahmoud Baumia, charged the Medical and Dental Council to devise a workable solution to the gap in numerical strength of medical and dental practitioners in the country.
The government is therefore delighted that a key focus of these reflections that you will be having will be implementable suggestions on how to creatively boost the local production of doctors and dentists at both the undergraduate and the specialist levels to meet the needs of our country.
The council is expected to come up with ways to produce more doctors and dentists for the country.
The government says it is worried about the increasing number of clinical negligence, poor professional attitudes and conduct, inhumane and degrading treatment of patients, and some medical practitioners who provide services outside of their competencies. At the Medical and Dental Council Conference in Accra, Vice President Dr. Mahmoud Baumia challenged the Medical and Dental Council to address these issues, as well as medical practitioners who work under the influence of substances.
Government is worried about the increasing numbers of complaints about allegations of clinical negligence, poor professional attitude and conduct, inhumane and degrading treatment of patients, and some practitioners who provide services outside their areas of competency of their training. And we are happy that the Council is defining clear boundaries so that the various categories of practitioners know the limits to their practice in the interest of patient safety and well-being. We commend the Council for being proactive in these matters, and I understand that some policy documents on the specialist register, practitioner stamp, name tag, and appropriate professional apparel, as well as scope of practice for physicians' assistants, were recently launched to address some of these issues of concern. Furthermore, Mr. Chairman, there are concerns about significant numbers of healthcare professionals who abuse substances or work under the influence of substances, including chronic alcoholism or suffer from infirmities of the mind. All these things may call into question their fitness for practice. Yet the experience from the Medical and Dental Council Ghana shows that the majority of these professionals had challenges during their undergraduate training, and that early identification of impairment and intervention are associated with better outcomes.
Now, more than 600 women and 300 children still reside in witch camps, despite decades of campaigning for the closure of such places. Mr. Yahaya Al-Hassan, president of the New Ghana Social Justice Forum, says a detailed action plan is needed to break up the witch camps. He says the goal is to help the women return home with dignity without having to face fresh allegations of witchcraft.
A witch camp, common in the northern part of the country, is a settlement where old women alleged to be possessing supernatural powers for harming people are kept after they have been banished from their communities. There are several 6 witches camps in Ghana, housing over 1,000 women. These are the Gambaga Witch Camp, Kukuo Witch Camp, Nyane, Bonyase, Nabuli, and Patinga Witch Camps, all located in the northern part of the country. These witch camps have been in existence for over 100 years. Officials say there are also about 500 children living alongside the detained so-called witches in the various camps with no opportunity to access education. For years, attempts to close down all the witch camps have proved futile. The New Ghana Social Justice Forum, Mr. Yahaya Al-Hassan, believes that it is unacceptable for human beings to undergo the dehumanized process on assumption that they were witches.
Well, the witch camps in the northern region of Ghana It's very appalling, very abhorrent. It's very shame for innocent women to be chained, to be kidnapped into this custody. It's very abhorrent, and we are calling on all our parliamentarians, the urgency from them, to pass the bill now and to close this witch camps.
Mr. Yahaya Al-Hassan says many women have been unfairly accused.
The so-called witch doctors, they are criminals. They need to be prosecuted now. We saw what happened to 90-year-old Ekuya Dante, a very innocent woman. But because one witch doctor said, oh, the old woman is a witch, what happened to her? There was a mob attack. She was beaten to death. And we don't want such to happen in Ghana again. That's why we are here to educate the public, to stop the false accusation of women as witch.
For interest groups, government can also consider renovating the camps to be a safe haven for these women by establishing a care home, clinic, potable water, educational facilities and other essentials to enhance the well-being of the women. This is because most families of these victims are not ready to accommodate them. Again, the lynching of Ekuya Dante, though heartbreaking and condemnable, is proof that authorities must take the bold decision to close down all such places and liberate the women who have been branded witches.
Let's look at education now. RME helps children to explore the world's major religions and views alongside some core beliefs, traditions, values, and practices. It is believed this instills them with justice, wisdom, compassion, and integrity. For these reasons and more, the first professor of religious and moral education in Ghana, Reverend Professor Seth Asari Danso, says religious and moral education, RME, should not be scrapped as an examinable subject. He was speaking at an inaugural lecture marking the University of Cape Coast's 60th anniversary celebration and charged policymakers to strengthen the RME curriculum to make the subject relevant to society. Professor Seth Asari Danso is proposing that the National Council for Curriculum and Assessment, NASA, champions these reforms.
There are no government-approved textbooks for religious and moral education (RME), although the subject is examinable at the Basic Education Certificate Examination (BECE). The situation has compelled teachers to fall on books written by private individuals to teach. Religious and moral education was on its own expunged from the school curriculum and incorporated into other subjects when the new educational reform was introduced in September 2007. However, the subject was reintroduced in 2008 after calls by interest groups, especially religious bodies, for its reintroduction. Reverend Professor Seth Asari Danso is the first RME professor in Ghana. He has developed and taught course in RME since 2001 and was a professional teacher for the past 30 years. His research interest is in religious and moral issues, curriculum and instructional issues in education, history and management of education. According to him, religion and moral education are essential for nation building. Professor Asari Danso insists that RME instills discipline and good morals in society and must be promoted at all levels of education.
I also recommend to curriculum developers, NACA, that NACA should review its curriculum to ensure that moral education is integrated into all disciplines in order to give pupils a solid moral foundation, because that is what Ghana needs. Otherwise, we will continue to experience moral decay in our Ghanaian society.
The senior lecturer who doubles as the professor of religious and moral education at UCC challenged the 4 public universities and their affiliates to review their curriculum on religious studies.
Government should provide incentive packages like scholarships to attract people to pursue TVET education. Otherwise, people will not be attracted to pursue TVET education.
Reverend Professor Asari Danso appealed to the government to make RME a core subject at all levels of education, including the preschool. The inaugural lecture is part of activities marking the University of Cape Coast's 60th anniversary celebration.